Your symptoms could mean something serious, so don't wait. Talk to a doctor right away, by phone, online, or in person.
Brought to you by Bristol-Myers Squibb and Pfizer.
Some big news. Since Election Day, almost 5 million people have downloaded the free Newsmax TV app on their smartphone. You can trust Newsmax TV. Watch it for free anytime. And go to Newsmax.com for breaking news. Newsmax is on all major cable systems. Call your operator if they don't carry it. Plus, watch Newsmax on Roku, YouTube, Apple TV, Xumo, TiVo Plus, Pluto, and smart TVs like Samsung and LG. Newsmax is real news for real people. Start watching today.
Heard the good news about COVID-19 vaccines? They're here, but you can do more than wait for your turn. Here's how. Stay at least 6 feet away from folks you don't live with. And it's risky to be indoors with them, too. And masks? Well, they protect both the person wearing them and the folks around them. Wear a mask, watch your distance, and make a big difference now.
Learn more about vaccines at cdc.gov/coronavirus. Brought to you by the U.S. Department of Health and Human Services.
8:09, Team Hochberg Traffic Center time, and Jim Telemonte.
On the inbound Kennedy this Friday morning, we see delays Cumberland much of the way to Central and Addison most of the way to the Burn Circle. It's a 38-minute trip from O'Hare to downtown, 21 minutes from Montrose, 13 in the express lanes. Outbound 22 minutes downtown to the airport. Inbound Eisenhower delays now kick in at North Avenue. 40 minutes, 390 to downtown, 25 from Wolf. Outbound 30 minutes downtown to 390. There is a crash on the exit to Costner. Inbound Stevenson, it's 37 minutes, 355 to Lakeshore Drive. Outbound 22. Inbound Ryan, jammed 35th to Roosevelt with a crash. 41 minutes from 95th Street to downtown Chicago. The outbound trip time is 12 minutes. That's traffic. I'm Jim Telemonte.
Chicago's Morning Answer continues next. AM 560 Weather Center forecast. We'll see partly sunny skies today and a high of 55, a low of 30 overnight. It's 39 at O'Hare, 42 Lakefront. Your next news update is at 8:30. And Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
From the Matrix Home Solutions studios, this is Chicago's Morning Answer on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560, The Answer.
Top of the morning, Dan and Amy. Our friend Jeffrey Tucker writing over at American Institute for Economic Research. The collapse of trust in public health, citing a new round of surveys published in the New England Journal of Medicine, finds as few as 16 and 20% of respondents, respectively, say they have a great deal or quite a bit of trust in pharmaceutical companies, in media, number one, 16%. Pharmaceutical companies, number two, 20%, to provide accurate information about the COVID-19 vaccines. 16% say they trust the media. 20% say they trust pharma companies to provide accurate information about COVID-19 vaccines. It's a collapse of trust in these public health professionals generally. Tony Fauci was on the Today Show yesterday in advance of Joe Biden's speech last night. Here's what he had to say about the problem that afflicted the response to the virus over the last 12 months.
But one of the things I keep hearkening back to that you can't run away from is that we had such divisiveness in our country that even simple common sense public health measures took on a political connotation. When people, if you wanted to wear a mask, you were on this side. If you wanted to stay in and avoid congregate settings, you were on this side. It wasn't a pure public health approach. It was really, very much influenced by the divisiveness that we had in this country.
Mm-hmm. I think it was also influenced by people who are pretending they're above politics when they're not, like Tony Fauci. For more on this, we're pleased to be joined by the aforesaid Jeffrey Tucker, editorial director for the American Institute for Economic Research, author of The Market Loves You, Why You Should Love It Back. Jeffrey, thanks for joining us again. Appreciate it.
It's my pleasure to be here. Thank you for having me. Everything you just said is true.
Thank you. Yeah. I mean, he's right about the divisiveness, but the sourcing is what's interesting. That's the interesting discussion.
Well, I don't know what he's talking about. Common sense mitigation measures. We went through lockdowns. They shut our churches. They closed our schools. They locked us in our homes, told us to stay home, warned us that we're all disease vectors and pathogens, and that the only way to fix a virus was to destroy the economy.
Yeah, but why are you so upset about that? Don't be so divisive.
That's just common sense, right? We just have to lock down. We've never locked down before, and hopefully we'll never do it again. And it's not a surprise, the collapse in confidence in public health. I mean, it's absurd. I don't know if you watched Biden's speech last night. I didn't, but I see quotes from it on Twitter this morning. He said by July 4th, we could maybe gather with multiple families in small groups for a backyard barbecue. What is he talking about? I'm not sure what's going on in Chicago, but I mean, most of the country now is completely open, and it has been for months and months. I mean, Georgia's been open since April. People have been gathering in restaurants. Restaurants are packed. Our airports are full again, as full as they were pre-COVID. People are traveling. The beaches in Florida are being mauled, and I mean, it's South Dakota never shut down. What country does he think he's in charge of?
There's two different Americas, really, and he looked like an absolute fool during the time when he said, and graduations for high schools and colleges. We had graduations even in Chicago, outside graduations last year, and I know everyone's planning on having a graduation this year. So whoever is informing him, it's as if he's getting some really bad information.
Yeah,
it's so strange. It's either that or he's pretending as if creating his own reality. Himself, or wants to pretend that it's not open.
Well, right. So let's assume that the people that are in charge of the Biden administration, I'm setting aside Joe for a second. Let's assume that they actually do know what's going on in the country. So why give that speech? Why present that false picture of what's happening in America? Why try to project the illusion of control so as to feed the delusions that still exist among so many Americans? Perhaps there's something afoot in terms of what they would like to do as people are emerging from the pandemic that like to try to slow this down for some reason.
It's possible that the speech was designed to spread and perpetuate fear and prolong it, to prepare for somebody else. I don't think it's successful, though. He sounds like a complete, like he's, I don't know, like on another planet. I mean, and people listening to that must have looked at each other and said, "What?"
Yeah.
I think the tell was when he said that by May 1, all adults in all 13 colonies will be able to get the vaccine. I think that was a tell that maybe he's not quite on top of things. Something going back to Tony Fauci, though. Here's the thing. It's not that public health professionals were wrong. It's how they were wrong. Isn't it? It's how they addressed us, people like him, how they addressed us over the last 12 months. You can be wrong, but you can do so in a way that says, here's what we know, here's what we're trying to find out. You know what, I was wrong about what we said earlier on because we were coming from this place, and so now here's what we know, and here's what we're still trying to find out, and bring us along. But that's not how they did it.
Fauci, I don't entirely understand where he's coming from, actually. It's actually, I don't know if you know this, but 2 days ago he was on a Zoom call with the head of the CDC in China, in Beijing, basically a Communist Party official, who just stood up and lied about how the lockdowns worked and so much better than the U.S. because we didn't lock down enough. And Fauci said, after his long, ridiculous presentation, full of false data, full of lies, it was unbelievable. Fauci said, I agree with everything you just said. And they had this friendly conversation. This is Fauci talking to a Communist Party official in the one-party state of Communist China. And he's saying, and he's praising him and his lies. This actually happened just 2 days ago on a Zoom call. And you can look at it right now on YouTube, and it's there. And that's what we're dealing with Fauci. I mean, I don't know why there's not hearings. I don't understand why, there isn't a close look into the relationship between U.S. health officials and the CCP.
Sure, I agree with that. I mean, the only one who's really taken him to task publicly on a consistent basis when he's appeared before the Senate has been Rand Paul, and partly because he was sanctified by Trump and many Republicans early on, as much as he was by the left.
Trump was tricked by him. The other thing we're finding out, I don't know if you know about this, we got a Freedom of Information request out from a nonprofit. A lot of Fauci's emails. It turns out that the U.S. sent a delegation to Beijing in middle of February to learn about their glorious virus mitigation tactics. And they came there, and they came back, and they told Trump that we have to pursue the China way. And Trump, for whatever reason, believed them. And a month later, we were locked down. So this actually happened. We have all the emails. This is not conspiracy theory. We've got all the emails. They're redacted in places, but there are 300 pages of them. We published in Economic Research. You can look at them. We go through them. It's absolutely shocking. It's beyond belief. We went through decades of hearings back in the 60s, 50s, 1950s, 1960s to ferret out, agents of communist Russia within the U.S. government. Where are the hearings? Where's the outrage?
Let's pull back. Let's pull back from Fauci and let's talk about medical doctors and public health professionals more generally. That industry of experts, if you will. I mean, you guys over at AIER launched the Great Barrington Declaration, spearheaded by Jay Bhattacharya from Stanford and Sunetra Gupta from Oxford and Martin Kulldorff from Harvard, and hundreds of thousands of people, regular Americans and all over the world, signed it. What about the reckoning within that discipline of infectious disease expertise? It's one of those questions we talk about with the academy more generally. Can it reform itself? Can all those people who signed the Great Barrington Declaration, particularly the infectious disease experts and the medical doctors, can they deliver a reckoning to the Tony Fauci's of the world and their world?
This is a serious question, and we have to remember that the people who favor these kind of lockdowns, Chinese-style policies and closures, and that's a tiny minority of the profession. It's not the majority. There's still plenty of people with good sense. And you're right, they all signed the Great Barrington Declaration. We're talking about tens of thousands of people, if not hundreds of thousands of serious intellectuals from all fields, including especially medical doctors who uniquely oppose all these things. They know that the right way to deal with disease is not through lockdowns and terror policies. You deal with the disease through therapeutics, one individual at a time. So there's going to be a lot of rebuilding that's going to be taking place. And I think what's happening right now is kind of in hiding. They're scared, and they're worried that their careers on the lines are going to be discredited and blamed, as they should be, for direct American prosperity and freedom over the last year. There has to be a reckoning, and there's going to be. I think you're right. Within the medical community and public health generally, there's a huge civil war that's going on, and it's getting brutal, and it's going to be a very long time before public confidence in them starts to go on the rise. And it's only going to work once people admit what an egregious error they made. But you notice there's not that much. There's very few apologies forthcoming from these people.
That's right, and the other thing that needs to continue is the research. Making the assessments. And so this research, I think you cited in your piece as well, from Brazilian academics that finds that the lockdowns did not have anything to do with transmission in something like 98% of the cases they looked at.
Oh, yeah. And that, we've assembled 31 huge empirical studies showing no relationship whatsoever between destroying people's lives and fixing the virus. It's just you can toggle the data up down sideways this way, that way, and torture it all you want, you're never going to find a correlation, much less an inference of causation there. So it's just, this is a serious problem. I mean, even the lockdowners are admitting this. I read an article this morning on Bloomberg where they were saying, oh, well, we had to lock down because of COVID-19. Way deep in the article is a passing remark that, well, you know, we can't really seem to find any connection between improved virus results and government. Nonetheless, it makes sense, you know, that if you stop the virus gets stopped. You know, so people admit it. This is a serious, serious problem. There's not a credible study out there that shows any relationship between these mitigation measures and virus control. That's a problem. That's a serious problem.
Do you think we'll ever go back to normal?
Yes.
Even in lockdown states, yes?
Oh, yeah. No, I mean, it's happening already. I mean, it's funny to see what's happening in New York, as I say. But every restaurant's packed, every bar is packed, nobody's wearing masks. It's all just ridiculous. And same thing, even in lockdown Massachusetts. I mean, it feels mostly normal. We're at 100% capacity. Restaurants. People are fed up with this, you know. The spring is here. We went through a year of, we now know that we know what we knew this time last year, which is that this virus is wicked for the very, very sick, and for everybody else is a small annoyance, just like, you know, all pathogens are. And that was the story a year ago, and it's the story again. And people are recognizing this and realizing this, and the numbers seem big. But, you know, we're going to be spending a good part of the rest of this year trying to unpack these numbers, what actually happened. The data is not as good and clean as we wish it were because of the inaccuracies of PCR testing, incentives towards mysteries we need to solve. There was no flu season this year. How do we account for that?
Mm-hmm.
So, you know, and the excess deaths, you know, even CDC itself says that at least a third of the excess deaths that we've seen over the last year were not attributable to the virus, but to lockdown policies. In other words, deaths of just drug overdoses, suicides. It's just, it's so unspeakable, the list of harm that's been done. And there will be no stopping this reckoning. It's going to be happening. This is what 2021 is going to look like. And my personal prediction is that we'll never again in our lifetimes see any more, at least in the United States, attempt lockdowns, because the costs are just so egregious, and people do not trust government. They don't trust media. They don't trust public. Never going to go there again.
Well, we'll get back to normal, but many of us are going to get back to normal in different states than we used to reside. That's one of the outcomes of COVID-19 too. But the lockdowns, the response to COVID-19, I should say, they even got me doing it. Jeffrey Tucker, editorial director for the American Institute for Economic Research, author of The Market Loves You, Why You Should Love It Back. Jeffrey Tucker, thanks for joining us as always.
Thank you.
Thank you. And he joined us on our turnkey.pro answer line.
There's only one radio show in Chicago talking about today's biggest stories and telling you what they really mean. That show is this one, Chicago's Morning Answer on AM 560, The Answer.
Signature Bank is Chicago's fastest growing independently owned business bank. It's a bank where relationships still matter. Signature Bank knows your name and your story. I'm Dan Proft, and I know this because Signature Bank is my business bank.
I'm Larry Nora, founder and CEO of U-Store It, a network of award-winning self-storage facilities in the Chicago area, and a customer of Signature Bank. We've developed over 70 storage centers throughout the city and suburbs, and our business continues to grow. We need a bank who understands the neighborhoods and communities where we are making investments. We found that in Signature Bank. They know this city and its neighborhoods because they are based right here in Chicago. Finding a local banking institution like Signature Bank has been critical to the success of U-Store It, and we look forward to a long-term relationship.